The mission of Colonial Behavioral Health, the local community services board, is to facilitate opportunities for recovery, resilience, and wellness to individuals and families affected by mental illness, developmental disabilities, and substance use disorders. Through an array of strategies and collaborative partnerships with local and regional providers, CBH will demonstrate a commitment to quality assessments, prevention, treatment, and habilitation through best practice methodology for the citizens of James City County, City of Poquoson, City of Williamsburg, and York County. Since 1971, Colonial Behavioral Health, the local community services board, provides mental health, developmental disability, and substance use services across the lifespan to individuals and families residing in James City County, the City of Poquoson, the City of Williamsburg, and York County. Our vision is to make our communities healthier, safer places to live. CBH currently employs approximately 200 employees and is headed by our Executive Director, David Coe, with oversight by a 15-member board of directors appointed by the localities CBH serves. CBH is funded by support of federal, state, and local government, grant funding, and service fees collected from insurance, Medicare, Medicaid, and self-pay. Over the years, CBH has strived to meet the growing demands of the community, implementing new programs and enhancing existing services for those seeking assistance during their time of need.
Success in healthcare requires that you be quick to adapt and effective in managing change in a very rapidly evolving environment. So we have attempted to structure our leadership and our board operations to maximize our effectiveness in terms of advocacy, management of programs, management of services, and management of the many projects that come our way.
Not only do we have a role in serving the individuals that come to us, but each and every time we are out in the community, be it at our community partners, be it at those volunteer sites, or being that just someone wants to run to Target, we are also providing an education to the general community. And that really helps us get beyond the stigmas of old and to realizing that people are people. And everybody has a life to live in this community, and we can do so successfully together.
We have three main roles. The first is to provide education, prevention, and outreach in order to increase awareness about mental illness. Second would be advocacy, because we need to give a voice to those individuals that may not otherwise have a voice so that others can understand what they're dealing with. And then finally is that we provide the services that they need in order to become independent and build resiliency.
No matter where you are in your life cycle, child all the way through senior years, whether it is a mix of different issues that you have, mental illness doesn't come in a clean little box, and developmental disabilities are not in a clean little box, and SUDs or substance use disorders are not in a clean box. So some provider somewhere that can deal with whatever it is that you're wrestling with and help provide treatment, support, resiliency, and actually help try to get ahead of this in other areas and try to find out how we can prevent these from getting worse in our community.
Well, one crucial role that Colonial Behavioral Health plays in the community is that it functions as a safety net. We provide, organize, and deliver a significant level of behavioral health care services to the uninsured, the Medicaid, and vulnerable populations. The Behavioral Health Division provides services to individuals across the lifespan. Community services boards provide mandated and non-mandated services. Examples of mandated services include emergency services, case management, and same-day access. Emergency services responds to behavioral health crisis 24 hours a day, every day of the year. We also maintain a drop-off center for law officers at Riverside Doctors Hospitals in Williamsburg. We provide outpatient services to children and adults for mental health and substance use disorders, to include intensive outpatient program and medication-assisted treatment for opiates addiction. Our psychosocial rehabilitation services provide case management, mental health skills building, and a day program known as People's Place. Our staff includes licensed therapists, nurses, psychiatrists, case managers, and peers.
Developmental services includes case management and services and supports necessary to assist individuals to live independently and be active members of their community. This is achieved through community integration and social and leisure opportunities offered in DD Day and residential services. To facilitate these opportunities, we provide transportation to these program services. In the future, we'll be implementing housing and employment services because we believe that housing, having a stable home environment allows you to be more active and well within your own community.
The Operation Division provides the infrastructure and resources to support service delivery. It includes project management, prevention services, and special projects.
Organizations can be in their community or they can be a part of their community. And I do think that CBH chooses to be a part of their community. It can be a little challenging because it's regional, so there's 4 localities to work through the different nuances of. But that's how we do things here. I think our Greater Williamsburg area, while we have our nuances that we do in our particular locality, we recognize the value of working together because families move, people move, and I think we pool our resources in a much better way than if we just siloed out even more.
Colonial behavioral health, most people, if they think about CBH, they think about one service or another service. It's sort of like the man who touches the elephant, and he sort of understands that piece of the elephant. What we hear consistently from individuals who come on board as new board members and so on is when we do the orientation, they sort of get an idea of everything we do. They're like, wow, we had no idea. The ability that Colonial Behavioral Health has not only to work with someone at the beginning, sort of help figure out what's going on and put some services around them, you'd be amazed to know that the network and the array and continuum of care that's available doesn't exist anywhere else in the community. There are many others who do this service and that service, or maybe 2 or 3 other services. But through the lifespan, the array of services available, it's unique to Colonial. So in closing, welcome to CBH. I encourage you to engage with fellow staff, enhance your skills as a clinician and as a professional, get to know the services that we offer, not just those that you provide, and take pride in your role in helping make our community a healthier and safer place to live.